today we are at the Society of Vascular Nurses Association conference in Tucson, and here to speak with Karen Fitzgerald from the Vascular Group in Albany, New York. Karen just finished giving a presentation at the conference and thought it would be interesting to follow up with her as a nurse working with CCSVI patients. So Karen, first, would you like to introduce yourself?
Sure. My name is Karen Fitzgerald, and I'm a nurse practitioner and director of nursing for the Vascular Group, and work with Dr. Maida. And about 2.5, 3 years ago, Dr. Maida began treating patients with CCSVI, multiple sclerosis. And there was certainly a learning curve involved for myself as a nurse practitioner in regards to treating patients and managing patients, since these patients were not our typical vascular patients, if you will. So in learning the not only multiple sclerosis, but the symptoms associated with that, and working in cohorts with Dr. Maida has certainly been just a huge, wonderful experience. The patients themselves have truly guided me and educated me in regards to not only multiple sclerosis, but CCSVI.
Okay, Karen, I was interested, yesterday evening there was a welcome reception, and was able to speak with a couple of people while we were having dinner, a couple of the nurses that were here, and they were completely unfamiliar with CCSVI. And so it's interesting this morning at during the meeting here that there seem to be quite a few nurses that really are not familiar with CCSVI, and being, I guess I figured, actually I think that everybody should know about it. Maybe that's because it's kind of a day-to-day thing for me, but is that true that there's here? Do you feel that?
You're absolutely correct, and that's one of the reasons why we wanted to be here at this meeting at the Society for Vascular Nursing, to spread the word and get people thinking outside of the vascular box, if you will, in regards to patients with CCSVI and how our roles with vascular surgery and vascular nursing can continue to evolve in treating this unique patient population.
Well, and I think with your presentation, you did such a wonderful job really explaining about multiple sclerosis, and it is a different disease. It's a hard disease. It's a complicated disease. And so the more information that the nurses can learn as far as treating or helping those patients, learning about the disease, I think is going to help those patients. So now, the vascular group, what do you see in the future here? What you will, as far as with your MS patients, treatments?
One of the things the vascular group in Albany is looking at is a surgical arm in regards to treatment for CCSVI, and we're still in the, working in the developments of that. And that's something that hopefully will be very promising, and something else that we can offer patients.
Mm-hmm. Can I ask, as far as follow-up, from your perspective with the patients that you have seen, you have what? You have a 3-month, or you've done a 3-month follow-up with the angioplasty procedures?
We do 3 months and then every 6 months.
And then every 6 months, okay. And with the 6-month follow-up, have you seen, what is your rate of, say, like stenosis? Have you had?
Well, about 85% of patients generally have favorable results. Mm-hmm. And one of the things that's so important, and was important to me in learning the symptoms associated with MS, because that's so important when they come back after treatment for a follow-up visit, so that we can talk to them in regards to what favorable results have they seen, and do they continue to experience. Mm-hmm. And overall patients have done quite well. As time goes on, patients may have possibly exacerbation of their symptoms from MS, and certainly this is not a cure. It's working with patients, and it's again, not a cure, but just to help with the
It's a symptomatic relief. Exactly.
Right, exactly.
And actually, you were talking about the relapsing remitting patients, and I think it's important for everybody, for the nurses here, to start to understand too that because that phase of MS, that somebody could have an exacerbation,
correct,
and then it goes away, and they may not have another one, but what you're treating here with CCSVI is really the autonomic symptoms, and there's like you were talking, the bladder control, that kind
correct.
of thing, heat sensitivity, and there's no drug out there right now that I think that is treating those, and
that's huge for patients.
It is. The quality of life issues are huge,
and that's what it boils down to. And I was talking to one of the other nurses earlier that it's all relative to the patient in regards to the results that they get. What's important to one patient in regards to the results may not be as important to the other. Whether it's somebody who has is more debilitated from their MS, say it takes two people to help transfer them into a chair or a wheelchair. Now, after they're treated, maybe it only takes one person. That's huge for the family and huge for the patient. So all those things in conjunction, like you said, with bowel, bladder, balance, fatigue, all those things just are...
Well, I appreciate you going through the learning curve for the MS patients, because as you probably found out too, that no MS patient is the same.
They're not.
We're all different.
And I tell patients, when I talk to them, because believe me, they're educating me every day, that it's this abyss, I call it. I go, there's this abyss out there that we're just trying to work together and try and get through in regards to helping patients with CCSVI.
Okay, well, I think that's probably, unless you have something else that you want to...
No, thank you. It's been an honor and a pleasure, and just to be a small piece of this very complex puzzle of patients with CCSVI, it's truly an honor.
Well, thank you. Thank you very much.
Thank you.